Hello, viewers. With National Cancer Awareness Day being observed on November 7 every year since 2014, we connected with the senior oncopathologist, Dr. Kirti Chadha, who is also a senior scientific officer at Metropolis Healthcare Limited, to
Hello,
know about
everyone.
the dreaded cancer and if such days help. Welcome, Dr. Chadha.
Thank you. Thank you.
Yeah. So, Dr. Chadha, I'll begin in the beginning. Why do we need such days?
See, this day is very important. I'm so glad, it was started in this country. Uh,
Okay.
because the biggest problem about cancer is that the lack of awareness, and
Okay.
because of the lack of awareness, because of the illiteracy, because of a lack of screening, and just simple this lack is actually causing cancer to get detected very late in our country. If you see the Western countries and Indian countries, it's not that the number of cases is more. It's just that it's detected late, and because of late detection, we lose these lives, precious lives. So I think this day is very important to create awareness.
Okay. So, in the last 8 years since it is being observed in our country, what changes have you seen?
Yes, so actually, it's like one thing needs to another. The biggest way to fix a problem is to know that there is a problem, right?
Yeah.
So only
Yeah.
when you will know there is a problem, you will find ways to fix them. And I think both the public, private, both the players have really, played a huge, huge role. I myself, I've seen in the last 8 years, we launched the oncology division at Metropolis 8 years back. And in these 8 years, whether it's in the country or it's in our own unit or it's in the own city, state, I'm seeing so much improvement in detection, improvement in treatment, improvement in diagnosis, improvement in the basic cancer care facilities, the free ones which come from the government as well as from the paid ones, subsidized ones. I think there's a lot of support and help coming from the corporates as well in terms of funds, grants. So I think a lot has happened, but there is no end to this, because the numbers are going to keep increasing and the efforts also have to be commensurate with that.
Why do you say that the numbers are going to keep increasing? That's a scary thing.
Uh, because of the way we live, right? So just the way we are all living is scary. So if you look at the heart disease was the biggest cause of death till some time back, right? It still is, but it is followed very closely with cancer, right? Cancer is the second leading cause of death. Now, 70% of cancer is preventable, right? 70% is preventable. Out of which,
Preventable.
yes, 70% cancer is preventable. And 40% of this is just caused by tobacco alone. Now, when I see people, on tobacco, and it's not the rich or the poor or anybody. You see a poor woman also stuffing her mouth, with that tobacco. What does it cause? It causes oral cancer, right? And tobacco actually is responsible for 12 kind of cancers. People tend to think it only causes it where you put it. No. And then nowadays, the latest fad among youngsters is vaping. Vaping is another kind of, tobacco. And then, of course, there is a passive smoking. So if somebody in my family is smoking, I'm also exposed to passive smoking, right? And there are so many of these cancers which are caused by tobacco itself. As I said, 12 kind of cancers are caused by tobacco. And it is so preventable, so very preventable. But who's stopping? Nobody is stopping. Everybody is just going on and on. And then they're coupling it up with alcohol, processed food, processed meat, inactive lifestyle, or I don't know. So all these things are just adding fuel to the fire.
Okay. Okay. So I'm still I still want to know that how marking one day, and obviously such things you need effort throughout the year, no, 365
Yes,
days.
yes, you need effort throughout the year, But see,
Yeah.
I'll tell you what happens when you celebrate your birthday, you actually growing through the year, right? You become a year older for the whole year. But
Yeah.
because a birthday is celebrated, so that day something special happens, right? A cake is cut, you get gifts, people wish you, people who'd forgotten about you also remember you. Similarly, when you mark a day, then everybody puts in efforts, right? So you will see all the hospitals, laboratories, everybody coming out with, awareness camps, promotions, discounts, camps, and anything that can lead a person to a center. So what does anybody have to do? You have to get yourself screened. Basically, you have to go, you have to consult a doctor, you have to get yourself screened. See, there is the issue of hereditary cancer also, though it's only 5 to 10%, but the risk is there. So if you have a family history of cancer, what you should be doing. If you have a risky lifestyle, what you should be doing. So and then there are various cancers and there are various preventive measures. But all this, just gets pumped up on these days, and that's how and then that activity gains momentum, and it goes shifts into the next gear, which is important.
Okay. So at Metropolis hospitals, what exactly do you do on the Cancer
See,
Awareness Day?
Metropolis has a very different way of dealing with this. Metropolis runs a Oncomet, which is the integrated oncology division. Okay, so it focuses only and only on oncology. So whether
Okay.
it's the entire ecosystem of Oncomet is just to help the cancer patient, and the whole, agenda is to give a conclusive diagnosis at a record time and at a very, very, affordable price, because cancer, they say, doesn't even take your life away, it takes your bank account also away, right? So
Yeah.
it's an
Yeah.
expensive disease. So we have something called as the Oncomet patient support program. So once a patient is diagnosed as a cancer patient, then we give lifelong discount to the cancer patient, because cancer patient needs test time and again, much like a diabetic patient or something. You constantly need tests, you constantly need medicine. So how do you support these patients? So the idea is to support. Similarly, there are the doctors, right? So there are doctors who are focusing on cancer care. Today, I see so many niche oncology centers, oncology hospitals, and they
Yeah.
also need. So we have hotlines. We have an iconic hospital hotline, and we service all these iconic hospitals who are trying to help cancer patients. So through all our, front, and we have so many collection centers, laboratories, through the entire digital as well as a brick and mortar system, we try to reach out to as many patients as we can and help them in whatever they need, right?
Okay.
So
Okay.
it's just a need based. You just have to fill the need. You don't have to do anything else actually.
It's basically educating them, educating
Educating
people.
them, helping them, navigating them, and supposing, sometimes the test also they're looking for is not the right test sometimes. So just, collaborating between the clinician, the patient, us, just arriving at the right test. Because, we've been awarded also by FICCI for this. We do a reflex based testing. So, for
Okay.
example, breast cancer, by the way, has become the most common cancer as per the Globocon data, you must be knowing. And
Yeah.
it has surpassed all other cancers as the main or the most common cancer, right? Followed closely, by other cancers, oral cavity, lung, in males, you have prostate, you have liver, colorectal, lots of cancers. But breast cancer has become the most common. Right.
What is
Now,
the
what
reason?
is this?
What is the
again
reason?
again a combination of things. So again, not only see, the reasons are different in the western countries. So of course, you have a late so you have a they have this the whole way, I don't want to sit and talk about the West, and it's a lifestyle thing, but everything from early menarche to a late menopause to a hormone replacement therapy after menopause, to not doing breastfeeding, again, to the kind of lifestyle, and not running, not walking, having excessive weight. So they say the high HDI countries actually have a more incidence of breast cancer, though now India is catching up there too. And of course, Indian women have to deal with cervix cancer as well. We know, in every age when it's a female dies of cervix cancer. Thankfully, good, the HP vaccine is coming up. But coming back to breast cancer, so, and then we know there is a BRCA1 and the BRCA2 mutation, which causes hereditary breast ovarian cancer syndrome. So there is your hereditary aspect, then there's your environmental aspect, then there is your own personal aspect, and then people do not go in for routine mammography screenings, and they don't even examine their own breasts, if I can say. And the moment they
Yeah.
feel a lump, they should go to a doctor, but that also does not happen. So very often I see that the cancer does not get diagnosed on time. So to coming back to the point that it's not that Indian women have more breast cancer. It's not like that. It's Indian breast cancer gets diagnosed late. And because it gets diagnosed late, it's already in a high stage. and sometimes high grade, high stage. And because of that, the response to treatment and the overall survival of the patient is not as good as in the West. Because in the West, they get diagnosed in early stage. So treatment is excellent. You can cure the disease. See, any kind of cancer is only curable in the early stage. In the late stages, you can manage it, but you can't really have a disease-free survival. It depends from cancer to cancer, whether 1 year, 3 years, 5 years, 10 years, 15 years. You can even go long as 20-year, survival, disease-free survival. But for that, you have to catch the cancer early and treat it correctly.
So that means that the Damocles sword is always hanging on. Once a person is diagnosed with cancer, is always under the fear of having it again.
Yes, of course, there is always a chance of a recurrence or metastasis. See, recurrence is when you again get the cancer in the same site, and metastasis when it spreads to other organs. So this risk is always there. But that is something that the cancer caregivers, they've got that. So obviously, even after you're treated, so the various ways you treat cancer. So if you're operated, if there is a surgery, after that you'll be given post-op radiotherapy or post-op chemotherapy. We even have new adjuvant chemotherapy now, which is given before surgery. And then after that also there are many, drugs, like now we have targeted therapy, which is more easy on the body as compared to chemotherapy. We have immunotherapy. And somehow you have to, use each and every therapy as and when required in the lifespan of the patient. And for every event that may happen, or a recurrence or a mets, you're prepared. Okay, now what am I going to do? And you have a constant follow-up system. So even when a cancer patient gets discharged, he's told to come back for a checkup in 3 months or 6 months or 1 year, depending upon what is the requirement.
But this thing is, it takes a lot of toll on the mind, no? So do you
Um,
have
No, not
uh,
really. I've seen very
anything?
brave cancer patients. See, I feel now we cannot treat it like a taboo. See, this taboo is also, we have to get rid of it. Again, if I give you some alarming statistics, it is forecasted that 1 in 5 patients, or 1 in 5 people is going to get cancer or already has cancer. But not all of them die, right? So probably 1 in 8 men or 1 in 11 women actually dies of it. Right? So we don't have to treat cancer as a taboo and a life is over kind of thing. I know so many cancer patients. I have been practicing onco for the last 20 years. And, there are patients who I've seen in my first year, they're still alive right now. So, I mean, you could die of a bomb blast or a road traffic accident tomorrow. So I don't think we have to treat it like, the world is over. Like everything else, we have to treat it like a project. Okay.
Any
And we
other
have to say,
disease? It's like
sorry?
any other. It's like any other disease. One
It's
must
a
treat.
chronic disease. It's a chronic disease now.
Uh,
So with
uh,
the way that medicines, the way the the medical world has taken it up, and we have managed to turn this menace into a chronic disease, which means we can manage it now. So managing it means taking stock of the situation, seeing what is the its correct diagnosis, what is the stage, what is the what is the biomarker, what is the molecular target, and just planning a good treatment for the patient and planning a full follow-up plan. So it starts from prevention of cancer to follow-up and maintenance, and you have to just be with the patient in the entire life journey. I mean, I don't think today there is a single family which does not have a cancer patient. So
oh
so
my
what?
God.
So it's okay. Somewhere in your distant relatives, in your first degree, second degree, third degree, I'm sure you will find one patient. And I'm sure that patient is doing fine because there is a whole team of doctors and healthcare professionals, taking care of this, just like they did for COVID or just like they do for any other disease.
Yeah, yeah. So, doctor, while different cancers will have different symptoms, no, that show telltale
Yes.
symptoms
Yes.
that told the
So,
body.
yeah. So, if I look at the most common one, your
Mm,
breast cancer. So, I always tell, that even if a woman just stands in front of the mirror and sees, nicely put your arms down and just look at your breast, if there's any change in them, So has something changed? Is the nipple retracted? Is there any discharge? Is, is the direction of anything changed? Or, and then if you feel it with the palm of your hand, with the flat of your hand, you lie down and you feel it with the palm of your hand. And if you feel any lump in either in your armpit or in your breast, you must contact, your doctor, and you must get a sonography and mammography done. Because if you catch it early, you're good. You can just get rid of it. Yeah. And
And what
like
about
that, each and every cancer has different, symptoms and signs.
symptoms?
But see what happens with some of them, which are deep-seated lesions, which are not visible or palpable. There is where, comes the importance of, screening. So that's why you have
Screening.
serum tumor markers. So we have serum blood tumor markers, for male and for females. For example, PSA is a very good marker for males, right? And then we have a whole lot of markers for females, CA125, CA. There's so many serum tumor markers. And similarly, there is your radiology test, which can be done. So there are many ways to detect it, and
So that
you have to be conscious about if there's any change in your usual pattern, anything, whether it's your whatever your usual pattern is. If there's a change in your body, any body part, like whether it's your GI system or whether it's urinary or anything, if you see any change, I think you must consult your doctor.
that means you have to be aware of your body and be
Yes.
mindful of what is happening. Normally,
Yes.
people are not careful about all that. We
Yes,
take
and
our
that is
bodies
why
for
the
granted.
relevance of yes, and that is why the relevance of annual health screens is so important, right?
Yeah,
At
yeah.
least once in the year you mark yourself, and if not, at young, less than 30 and all is not that, but at least from 40 onwards you have to become more alert, right?
Okay, okay. So, is there any particular age that cancer impacts more, or any
See,
age
it
it
is
can
a
affect?
Yeah, of course. See, we have pediatric malignancies also, right? Even children get cancer. But if you look at the other, routine group of cancers, generally the incidence increases with age. So obviously all the, screening protocols and everything, they set in after 40, 50, 60 respectively for various organ systems. But you can get pediatric cancer also. But those generally are very symptomatic, and they scream that I'm here. You know.
Okay, okay. And you were talking about the hereditary cancer. So,
Yeah.
I want to know that first thing is, how is it passed? Is it? I heard that it is the mothers who are passing on the cancer
No,
genes to.
no, no, it's not like that. So basically, let me just explain that hereditary cancer or the is not that it's not definite that you're going to get cancer. It is just that you have a higher risk. So supposing I'm one person and there is another one person, and I carry one of the hereditary genes of cancer. That means I have a higher risk than the person sitting next to me. It is not that I will get the cancer. It is just that the chances of me getting it are more than the person who does not carry that gene, right? Now, having said that, hereditary cancer is only 5 to 10% of the cancers. That's it. Okay.
Okay, okay.
90% cancers are not hereditary, right? Like, for example, cervix cancer, which is the biggest menace today, or lung cancer, which is the biggest cause of cancer death. None of them are hereditary, right? So they're not. So hereditary cancer is just one type of cancer, which may happen in 5 to 10% of the cancer patients, that they have a higher risk. But the good part about is that today all the screening, the molecular signatures are known, and you can actually get yourself screened if in your family there has been an index case, right? So
Okay.
hereditary breast and ovarian cancer syndrome, as we call it, though unfortunately breast and ovary are the two most common cancers in women. I mean, as a part of hereditary breast ovarian cancer syndrome. But there are other cancers also, like prostate, pancreatic, this, that, and all. And because these are more common in women, that's why people tend to think that you get it from the mother. But actually it's not like that, right? So,
Okay.
but because it shows up in the mother, right, it shows up, so that is how it is. But the gene is there in the family. Yeah. But obviously, if you have a maternal aunt or a maternal, so if your mother or her sister or, like that, if any of them had, then you could be carrying the risk. So it is worth doing the test.
Okay. So, in case of hereditary cancer, can we prevent them? Can the next generation do something to so that it doesn't happen? First thing, and
Uh,
secondly, when you talk about testing and screening, so what age should a woman or a girl should begin the testing process, the
Yes,
screening process?
two very good questions. So
Yeah.
once the gene is in your body, right, you
Mm,
cannot prevent it or avoid it, right? But it is not necessary that all the people of the family will carry the gene, right? So supposing my mother had the gene and we are four sisters, it is not necessary that all of them will carry the gene, right?
mm,
So
mm,
only 1 in 4 chances there of carrying the gene, right? So
mm,
definitely if there are four children, one of them will carry it. But once you have the gene, you cannot do anything about it. The only thing
okay.
that you can do, as you said, what do you do then? You start screening. That's all that you
Mm,
do. So
okay.
because now you know that you may get it, so if you start screening earlier than the general population, there is a chance that you will pick up the tumor early, and it
Mm,
will be so small that time that will be very, very, very manageable, and that is the most important thing, and that is why it has become so common. But still, I don't recommend general blanket, genetic screening. It should not be done. It should only be
okay.
done after genetic counseling. So for example, we do a pre and a post test genetic counseling. And
Okay.
what does that mean? You see the entire pedigree, exactly the questions that you were asking. Who
Yeah.
carries the gene? What are the chances? So we do
Yeah.
make a whole pedigree chart, which is like a family chart, family tree.
Yeah.
And according
Yeah.
to that, we recommend whether you should get the test or should you not get the test. And
Mm,
even after the test results come in, we always, inform the patient and the doctor that these are
mm,
the chances, of
mm,
this patient carrying, or this
mm,
person carrying the risk. And these are
mm,
the options that can be done. And I think similar thing the clinician does. So the
mm,
clinician will also sit down with the patient and explain everything that,
mm.
these are the various options available in front of you.
Okay. And I was asking about the age at which the screening should begin in case it runs in the family and
Yes. So, see, normally we say that, you start screening after 40, after 50. Generally, most of the elderly cancers come in there. But when there is a risk, so there is many schools of thoughts and there are like 6 different guidelines. But what they say that, after, if there is a family history, starting screening after 30, 35, there is a very good chance that you will pick up those early cancers. Because if you
okay.
start only after 40, 50, then,
Hmm.
the tumor has already progressed a little bit. So,
Hmm.
it's not a good idea. Yeah.
Okay.
I know of many women, who are doing regular screening, and then, some 3, 4 years they've missed the screening. Okay.
Okay.
And then they got it. So you can't miss it. So, so best to see your own family pedigree, do a pre-test genetic counseling, consult a doctor and start your screening.
Okay. Okay. And in the last 20 years, since you have been in the profession and treating cancer patients, how much of change have you seen in the numbers?
Yeah. So numbers are not good, right? Because we also have an aging population right now, which is a good sign, right? So people are living more because people
Hmm.
have a longer lifespan now. So
Hmm.
because we have more a geriatric population, an elderly population, and since they are predisposed because of age incidence ratio, so obviously the chances are more because of that. And then, as I told you, all these factors of smoking, alcohol, very, very pathetic lifestyles,
Hmm.
is not helping, right? And and see, though we know, we were talking about causes, right, at one point in time. So I was
Yeah.
telling you the various causes. So tobacco being a big problem, alcohol being a big problem. Another cause is infectious agents, right? So even if we just take CS cervix for an example, we know that HPV causes it. Right, we know that Hep B, Hep C, all of these are important. This thing for liver. So there are so many infectious agents, so many viral agents which we know cause, cancer. But
Hmm.
now I'm thankful that the cervical vaccine is now getting released this year in India. It was
Hmm.
there earlier also, but it was very
Hmm.
expensive. So very few
Yeah.
people could afford it. But
Yeah.
now thankfully with the COVID vaccine, the way everybody took the COVID shot, I'm hoping,
Huh.
that now all the girls, so I
Huh.
would recommend anybody with a daughter to, give them the COVID, to give them the, CA cervix shot. And
Okay.
it's best before, the first sexual exposure. So ideally between
Okay.
9 to 14 years of age, all our girls should get vaccinated for CS cervix, because then at least we know that they don't have. We are going to we can think of eradicating CS cervix, which I think has been taken up by the Honorable Prime Minister and the Government of India, and that's a very good initiative to just
And
completely eradicate CS cervix with the vaccination drive. And more such drives are required, which I think will be fueled by awareness days like this,
okay.
to reduce the burden.
Okay. And what about you said 9 to 14 children, girls should have it. What about
Yeah.
14 to 25? Because that is also the
It's fine.
age.
It's fine.
Uh,
See, 40,
okay.
anything is fine. Up to 25 is also very good. Because, see,
Okay.
this I'm just saying because nowadays, people are getting into early sexual activity, right?
Okay.
So, basically, is before the first sexual exposure, the body hosts the best immune response. It's not that the
Okay.
host immune response will not get hosted later also, right? For
Okay.
example, between 10 people who took the COVID shot, the COVID antibodies are different in everybody, but
Work
everybody
different.
did get prevented, right?
Yeah.
It
Yeah.
helped
Yeah.
everyone. So it's the
Okay.
same thing. There's no last age to take it. People take it till 40 also, but it
Okay.
is better to just vaccinate our schoolgirls.
Okay. Also, the we have now vaccine for cervix cancer. So, are there? Can we expect vaccines for other kinds of cancers? Are they possible?
We should we should see all the causative agents that are known. Should be avoided and preventable. And there are so many, infectious agents which are known to cause to cause different types of cancer. And I think we have a very good, people working around the globe to work on all of these, because as you mentioned very correctly some time back, that now it has become like a chronic disease. So then you have to go more on the prevention now, right? So we have to try and prevent it. And if you look at the Globocon data again, that see, there is expected to be a 47% increase in the cancer cases by 2040. Right. So in 2020, we had about what 19.7 million or something, close to 20 million, and the number is expected to go up to 28.7 million. So there's going to be a more than a 40% increase, and we are not going to be able to just control this by just opening up centers and doing diagnosis and treatment. We have to go and prevent the disease, right? So the number of cases is only less.
And we need more surgeons, more onco specialists also. So,
Yes, yes.
like I digress a little. Are in the medical colleges, do students take up oncology
Yes,
willingly,
yes, yes, yes.
and
So
or they have to be motivated to do so, because it's quite a dreaded thing. A person may not be very mentally strong to take up such a, be with the patient who's at times not going to live.
yeah, yeah. No, no, I don't think that is the problem. See, I myself am a super specialist in onco, right? And I had lots of colleagues, and there was no problem. One good thing that is happening again, which the government has initiated, is I think giving more approvals for medical colleges. More cancer care centers are opening up. So because of that, we have more people who can get trained. We have more people who can get trained for cancer, and I think a lot of medical students are opting for cancer. In fact, there's a very interesting thing which has happened now. There is a super specialization in cancer also. So you have
Okay.
gynecologists who are doing onco, and they are becoming gynec onco, surgeons. So on
Okay.
and so forth. So you have breast specialists who are again doing onco and becoming breast onco specialists. So
Okay.
I think to answer your point, both the things are happening. So first of all, the number of doctors is going to increase. Secondly, the number of doctors are opting for cancer in any kind of format, whether in the diagnostic or in the treatment thing, is both increasing. And the third thing that is happening is that super specialists are also, engaging in onco niche area. So I think we have a lot of healthcare providers who are rising to the occasion, and that's a good thing.
Okay. So, in the last, say, 10 years, a decade, what is the major breakthrough you've seen, you would talk about, which has happened in cancer treatment?
See, two major breakthroughs have happened. One is the molecular. So, molecular is the biggest breakthrough. right?
Mm.
So
Mm.
what used to happen earlier is when a cancer, as you were saying, that no, it's very depressing. Earlier, it used to be very depressing because there were very few options that we could give to the patient, right? So and most of them were very tough on the body. So they
Mm.
were so now because of now we know the molecular basis of most of the cancers. Okay, there is
Okay.
still a large journey left, but because the human genome has been mapped and many
Mm.
of the molecular targets are now known. Because of that, you can actually target the tumor per se without harming the rest of the body.
Okay.
And that has, I think, been a godsend,
Mm.
because today the cancer patient has so many options of treatment which were not there before. And because of that, it is very important to diagnose the cancer very, very correctly, subtype it very, very correctly, and then actually specify in that which is the underlying molecular, gene which has caused the problem, and which one it can be targeted. So
Mm.
now there is something called as companion diagnostics. What is companion diagnostics? That you have a drug and you find the target on which that drug is going to act. And
Okay.
this ecosystem has to be. So on this platform, you do this test and then you can give this drug, right?
Okay.
Like we just
Okay.
spoke about BRCA. So for
Mm.
BRCA, now there's something called as PARP inhibitors, right? So there are
Okay.
many drugs. I'll not take trade names, but
Mm-hmm.
basically the broad category is PARP inhibitors. So
Mm-hmm.
today, a BRCA positive, let's say a ovarian cancer patient who,
Mm-hmm.
of serous carcinoma, who earlier was a very tough tumor to treat. Today,
Mm-hmm.
that patient can now be given PARP inhibitors, and that is
Okay.
easier on the. So the biggest revolution, evolution, and the help that a cancer patient has got, I think, is in terms of targeted therapy and
Mm.
immunotherapy.
Okay.
And
Okay.
immunotherapy is not using the body's own immune system to fight the
Mm-hmm.
cancer.
Mm.
That has
Mm.
also become very, very, common now.
So does that mean that a person who's have obviously you will still do chemotherapy, no?
Yes, so these are all additive, right? So there is surgery. You can then combine the chemotherapy with some targeted therapy, with some immunotherapy. So that is, there are protocols. So there are NCCN guidelines and there are
Mm.
ASCO-CAP guidelines for all of these things, and you can follow them and you can plan the entire treatment for the
And
patient.
and it will depend upon patient to patient. It's specific to patient.
Yes, there is a good extent of personalized and customized cancer care treatment available today, which is
Mm.
also because of the same thing. Because even if I see 10 different breast cancers, they will all be
Mm.
a little different at the molecular level, right?
Mm.
Similarly, brain cancer. Now, earlier brain cancer was considered very. Now today again there are drugs available, right? Lung cancer. Now, lung cancer earlier, I remember till about 5 years back,
Mm.
in advanced lung cancer, the survival used to be few months. Today, the
Mm.
lung cancer patient is surviving till 3 years also, right? And that
Okay.
is only and only because of targeted therapy and immunotherapy.
So do these advancements also mean that when a patient is having a chemotherapy, it will be easier on his body like earlier, like you won't it the chemo drugs won't impact the entire system, all the
Yes.
systems, and you won't lose your hair or all. Does that
Yeah.
mean?
Yeah, I'll address both those things. So, first is let's get rid of this hair issue. You get
Mm,
back the hair, first thing.
mm,
So,
mm,
you lose the hair, but you get them back. So, don't worry. So,
mm,
even if you lose the hair for the time that you receive chemotherapy, invariably, as after chemotherapy is over, you start getting back your hair. That's first thing.
mm, mm,
Secondly, there are a lot of ways available now,
mm.
to counter that. But to answer
Okay.
your point, yes, targeted therapy is easier on the body. It
Mm,
harms the body and other systems much lesser. And much
mm,
of the side effects that we used to see with
mm,
chemotherapy are not
mm,
seen with targeted therapy. Again, one very, very big advantage of targeted over chemo is that it
mm,
doesn't have to be given all the time IV. There are tablets for most of them.
mm.
So
Okay.
person has to just take a tablet, right?
Okay. Okay.
For example, breast cancer targeted therapy has been there since decades, I think nearly not 10, 15 years. And that is
Mhm.
basically tamoxifen, which is given for estrogen positive breast cancer, which is just a tablet.
Hmm. Okay. Okay. So coming to lung cancers, I know in my circle, I know of certain patients like mothers of my friends who who got to know of lung cancer very late, and it was like they couldn't survive. So
Yeah.
I'm talking about two people at least who were not at all into smoking and alcohol, leading a very what you say healthy kind of lifestyle, and still they got detected about. There was cough that I won't say that wasn't there, but there was cough, and then suddenly you go to the hospital and the doctor is telling you it's this thing. Is
Yeah.
how does that happen?
Yeah, so see, two, three things. As I said, lung cancer is the most common cause of cancer related death, right? So, no
Hmm.
matter what we say about statistics, like, so we say breast cancer most common, or we say in the Western countries, prostate cancer is more common, by the way, in men than lung cancer also. But if
Hmm.
you see the chances of death, they are more with lung cancer than they are with prostate cancer, right?
Hmm.
So, lung cancer obviously has a high incidence of death related to cancer. Um, in causes, see what happens is that you are saying that they were healthy, right? But
Hmm.
one is constantly inhaling, right? There is, look at the pollution levels, right?
Hmm.
And also passive smoking. And there are
Okay.
many underlying lung disorders also. So you said there was a cough, So there are many reasons. It's not only one thing. It's an
Okay.
addition of many things which causes. Um,
Okay.
so yeah, and that is why I'll tell you some very interesting thought on what you just told me. You
Hmm.
will be surprised at the number of lung cancer cases that were detected during COVID.
Okay.
Incidental lung cancer, because
Oh.
people went in for CT. Remember, everybody who was a
Mhm.
moderate or severe
Yeah.
disease COVID patient went to get a
Mhm.
CT scan done. And
Yeah.
on CT, we invariably found a lung cancer nodule sitting over there.
So
So it
did they
is
have
there,
it
but
earlier?
cancer grows very slowly. Cancer grows very, very slowly, right? So that's why I said, now if they had a cough, if they had something, they should have gone to the doctor. At least the doctor
Okay.
would have got like some X-ray done, or some low resolution CT scan or high resolution CT scan. Something would have got done, right? They could have caught
Okay.
it early.
Okay. Okay. So now, I'll ask you another thing. What is the state of India when we talk about treatment? Numbers, I won't say ठीक है, numbers are there, but as far as treatment is concerned, how does India fare vis-a-vis Europe or West?
Very well. India fares very well. India has got the best, infrastructure available today. India's got the best doctors available. India's got the best labs available. Everything is there. Where India, gets hit, or these numbers do not show in the mortality or in the survival, is because of the late detection of disease,
Hmm.
because it doesn't get it. See, the West, when you compare our numbers with West, no, West, the disease is detected very early,
Hmm.
right? If you compare late versus late, you will see the similar numbers. But if you're comparing overall versus us, you will see that difference, right?
Okay.
Because unfortunately, in India, people do not take health seriously. People will
Hmm.
not, think twice before going and blowing up, 10,000 over a five-star dinner. But they will
Hmm.
not spend 500 rupees also on health.
Hmm. That's a sad
So
thing.
people take health very casually in India, and because
Hmm.
of that, it doesn't get. And this is the I'm talking about the pade likhe gawar.
Hmm.
I mean, some people are actually genuinely illiterate, right?
Hmm.
And they are
Hmm.
unemployed and they are below the poverty line, and
Hmm.
they do not have the money also. So
Hmm.
people who have the money are also not focusing on health. People who don't have the money, how will they focus on health? So I think there is where the government is doing a lot of things for the poor people, but the
Hmm.
poor person also has to reach that center, right?
Hmm.
So that is where this awareness days becomes important, because at least hopefully, somebody will, some NGO or somebody will shove them in a van, take them for a screening, right? So in the middle,
Hmm.
I had this idea of, actually taking a screening van and doing pap smear of villages. I had put up that proposal
Okay.
also once to the state government. Because what
Okay.
do you do? If a person is not going to come to you, basically you only
Hmm.
sit in a van, go with the thing and start screening. So
Yeah.
I think something like that will be required,
Huh.
because see what has happened, this whole issue of two Indias, do Bharat, it's a fact, right? There is a rural and a urban. So the whole
Hmm.
approach for rural and urban is very different. So in
Yeah.
rural, that person doesn't have two meals to eat. Where is he going to come to you? You only have to go to him. And
Yeah.
where we talk in the urban, we talk about, every 5 years you do your HPV, you do your cervix pap smear. You can't go and tell that to a lady, who doesn't have
Uh,
food to eat. Even if you
they
once in a lifetime do a screening, it's more than enough.
will they be open to it? That is another question.
They are okay. See,
Uh,
Tata Memorial Hospital has done a huge Barshi project, and they've done a lot of work in this space. There's a whole preventive care medicine of Tata. So I think everybody's trying in their own way. I don't want to name private players, but basically everybody is trying their best to think. But somewhere I think this taboo has to go, and people have to start taking a little bit of their health seriously. People have to
hmm,
start spending a little bit on their health.
hmm, hmm.
Even the health
You were,
insurance and all, sometimes it's not fully covered. If you see the health insurance,
I
it
was, I
doesn't
was,
cover thing.
I was coming to that. Cancer, see, health insurance, the health insurance companies, though, when a person is healthy, they'll give you insurance very happily. But the moment there is something, it can be any disease, and then they shy away from giving you the, and cancer is one thing they just keep away. They don't want to give you health insurance. So while that is the, as you rightly said earlier, that is most required, because cancer is like it drains your bank. So are you as a healthcare professional doing anything on this regard? Are
Uh, yeah, see, I'll tell you what are the two main things in this. No, there is a regulatory agency which controls the drugs, right, and which drugs and their pricing. I think the cancer drugs, all the new cancer drugs, should come under its ambit. Right now, they're not under its ambit. So I
okay?
think that's a very important change that is required. The second thing is that the government needs to audit, actually, that what is the pricing, like, the way we have a CGHS and all schemes running, right? We have a central government, has so many schemes are running where the cost of certain things, and you can audit them accordingly, and you can then allow that to happen. Similar thing needs to be done to cancer now, right?
Hmm.
So because now it is, we cannot run away from it. It's there to stay. It's only going to increase. So
Hmm.
the regulatory checks also, and the allowances also, both have to increase. Otherwise it's going to be difficult. Otherwise, as you said correctly, even though we will make all the efforts, but when we look at the mortality, when we look at the overall patient survival, then we will not shine through in the world, right?
Yeah, and
See,
that defeats the whole purpose, no?
yeah, and see these transitioning countries now, like Asia, continents, Africa, South America. They are the ones where the cancer numbers are increasing much more because they are the transitioning countries. Now, if I look at United States of America, Northern America, the turnover, the increase in the cancer rate will not be that much because they are generally the same lifestyle. Everything is the same. Nothing new is happening. But here, Asia, Africa, South America, here is where the action is.
Yeah,
Even
yeah.
on neighboring like Japan, China, you take all of these countries, India, you'll see alarming increases in the numbers because here is where suddenly everybody is, a little different than they were yesterday, right?
Lifestyle has changed
Too much
drastically.
change. Too much change.
Yeah,
So even
yeah.
if you're changing, see, like they say that, that the basic house customs remain the same. You can make them
Yeah.
better. You can build on what was there. You cannot just radically do something different and expect the same outcome. So, it's a trade-off, no? Everything that you're letting go. Right? The less you cook at home and the more outside food you eat, you have to
Yeah,
expect some impact of
yeah,
that in your budget as well as in your health, right? So
yeah, yeah. And you were talking about government being more open now.
yeah,
Tell
so
about that.
open in the sense that they are already open, but they have to be. I think a lot of public private partnerships have already started happening, right? So more of those have to happen because if you remember COVID again, COVID would not have been able to get managed if it was not for public and private
Private.
working together, right?
True,
So
true.
hats off to Mr. Chahal who led the entire project in Bombay. And the one thing that he made very clear that ICMR is a single source of truth. And we are all going to respond to that. And whether it is a private or a government, everybody has to open their doors. And when that happened, immediately we were able to meet the problems, right?
True.
And he sort of divided the problem, divided the city, and the resources got used properly. It was so well managed. So I think similar kind of an effort, the way effort was put in for COVID, a similar kind of effort, obviously cannot be put for everything, but needs to be put. I see government has taken a very good initiative with TB Mukt Bharat. Metropolis is a
Yeah,
part of that
yeah,
also, and it's
yeah.
a very good initiative. So like the way we are going all out for TB, we'll have to go all out for cancer also.
Okay, okay. So one last question.
Sure.
What kind of lifestyle changes do you what? How should one live life?
So I am no expert on the matter,
No, no, no,
but
no, no, no,
yeah,
no. Why I'm asking is
yeah,
because cancer is a lifestyle disease, no? And
yes, yes,
you have time and again said that, and which is correct also, that it is our lifestyle which is causing more of incidents. So I
yes. So
want you to
my
like
advice, yeah. So
list
my
certain
advice,
things that this
right?
is do, this is not done.
Yes, yes. So my advice to everybody over there is that first of all, please do not smoke. Okay, because smoking is causing, uh, as I said before, 40% of cancer is preventable. 12 organ system cancer is preventable if you just throw that smoke out. Smoke in any form, in tobacco, in passive smoking, in vaping. Just please avoid smoke. That is the first thing. Second thing is alcohol. Even if you're having alcohol, have it, moderate, very, very moderate. Don't become an alcoholic. Okay. Third thing is run. Run. What they say about, walking, running, it's all very important because this sedentary lifestyle and this accumulating excessive fat in our bodies is not helping because fat releases certain hormones. These hormones fuel our cancer. Okay. So we have to have a fit, lean, they say no excess of too much is anything is bad. So let's just eat how much we need. Again, what you eat is very important, right? So now there is a lot of fad of organic food and health thing, nutrition. But I would just like to say it very simple: eat like our nani and dadi used to eat, right? They used to insist on color in the food, right? So lots of colored fruits and vegetables. What I don't mean is artificial color. I mean that actually make sure that throughout the day you're having enough raw fruits, raw, things raw. And of course, whatever is cooked also is cooked in the right way and in the right thing. Because remember, all this thing that you're putting inside yourself, all this processed food and processed oil and processed is all going and harming you somewhere or the other, right? So these are a couple of my suggestions, and keep getting your regular health checkups done. And any infection in your body, get rid of it. Don't think it's going to stay there and it's going to go away on its own. No, it needs treatment. And all these, chronic infections, persisting infections, like what is even a small statistics about HPV, it's said that it's the common cold of the cervix. So anybody who has sex is going to get HPV infection. Getting HPV infection does not give you the cancer cervix.
Yeah.
Having the HPV persist in your body for years and then not having the immune system to fight it, that is what it is. And not detecting the precancerous lesion early, that is the problem. So get rid of all these, problems, and at least you can avoid some amount of this thing. And if in your family there is a family history of, cancer, then consult your physician, get your genetic counseling done, and get your entire family screened. Because nowadays, like us, I think most of the laboratories are doing it at a nominal price for the full family because we
Okay.
already know the molecular gene, right? So the
Yeah.
cost is also just 1/20th of what it would normally be. So, and anyway, the whole cost has reduced for everything. So don't run away. And last but not the least, even if you do get cancer or your relative or friend gets cancer, don't start treating them differently. Cancer is not contagious, first of all. Secondly, it's not the end of the world. There are bigger problems which are the end of the world. So please treat it like any other disease, and in the right hands with the right doctors, right care, you will be fine. So do not get worried about it. Nothing to
Okay.
worry.
Thank you so much, Dr. Chadha, for sharing your views and giving us so much of knowledge about, and I'm sure it will help many of us and many of our viewers also. And I hope we people become more proactive towards their own health and listen to whatever you are saying. Thank you so much once again.
Thank you. Thank
Thank
you.
you.
Thank you so much. Bye bye.